The information in this presentation was put together by members of your community. We understand that COVID-19 has created a lot of stress on families. And as schools begin to open, we know that your child's health is one of your top concerns. We hope this information on telehealth provides you with safe options to continuing to get the health care you and your family need. In this video, we will be talking about telehealth. Please look for our other videos on health insurance and primary care. Since early 2020, coronavirus has changed the way we access healthcare. One of those changes is the increased use of telehealth. Some people have canceled their regularly scheduled healthcare visits because they fear being in public during the pandemic. But medical concerns are not going away because of the pandemic, and telehealth is one way to continue to receive safe and effective health care. Telehealth is the use of electronic information and telecommunications technologies to support long-distance healthcare visits. If you have ever used FaceTime, Google Hangout, WhatsApp, Skype, or Zoom on your computer or phone, you may find a telehealth visit to be similar. Contact your local primary care provider to find out if telehealth is an option for you. A computer, a tablet, or a smartphone that has a webcam function are typically needed for telehealth appointments. Being in a location with a stable internet connection is important to a successful telehealth visit. Having the right equipment allows for a good video link so the patient and the provider can see each other and discuss health concerns. If you do not have a computer, a tablet, or smartphone, ask your provider if they can do telephone-only visits. Preparing for a telehealth visit is similar to preparing for an in-person visit. Write down any symptoms you have and keep notes of any changes in symptoms since your last appointment. If you monitor your temperature, blood pressure, or sugar levels regularly, be prepared to provide that information at the time of your appointment. If you have or had a fever, be ready to tell your provider how long the fever has been present or how long it lasted. Some providers may want to know if your weight has changed since your last appointment. If this is your first appointment with a new provider, be prepared to discuss any pre-existing conditions you may have and the medications you are currently taking. Also, make a list of questions you have for your provider to make sure all of your concerns are addressed. You should receive a link to your telehealth appointment from your provider's office, and some healthcare offices will send the link through their patient portal. So make sure you know how to log into the patient portal and find the link prior to the day of your appointment. If you receive instructions through email, read them carefully. Ensure your electronic device is fully charged and you have downloaded any applications or software needed for the telehealth visit. Find a private place for your telehealth visit where you will not be interrupted by family, pets, or roommates. Your provider will tell you if someone else from their office can hear or see you. There's a very small chance that someone could use technology to hear or see your telehealth visit, but most healthcare offices use secure internet connections. Most insurances cover telehealth visits. Many insurances are waiving copays and deductible during the COVID-19 pandemic and have even increased the types of healthcare services that can be provided through telehealth. The services available through telehealth will be based upon your insurance and your primary care provider. If a health concern cannot be addressed with a telehealth appointment, your primary care provider will let you know. Telehealth is a safe and convenient alternative to an office visit. Your primary care provider may provide telehealth appointments for allergy, asthma, cold and flu, infections, and many other health situations. If you recently canceled a healthcare appointment because you feared being in close contact with others who may be sick, then please consider rescheduling your appointment and asking if a telehealth visit is an option for you. If you are a person at high risk for severe illness from COVID-19, then using telehealth for discussing lab results or for post-operation check-ins may be an option you'll want to consider. Many of the personal healthcare concerns you had before the pandemic are still concerns today, and coronavirus is not a reason to ignore your health. Please do not attempt to use telehealth for life-threatening emergencies such as chest pain, seizures, numbness or tingling in your face, arms, or legs, or for a head or neck injury. You should always call 911 for medical emergencies. In addition to telehealth options with your healthcare provider, there are several other health-related supportive services that offer opportunities for telehealth appointments in Tompkins County. Your health is important, and helping you find solutions to your healthcare needs is important to us. To find out about other health-related services available to you, call 211. 211 connects people in need with services designed to address those needs. Your health and our community are important to us. We hope you found the information in this presentation helpful.